Occupational therapy, OT, and sensory integration techniques play crucial roles in supporting students with intellectual disabilities, ID, by addressing their sensory, motor, and daily living skills challenges. Here's some information on the role and techniques of occupational therapy and sensory integration for students with ID. Role of occupational therapy, OT. 1. Functional independence. OT focuses on promoting students' independence in activities of daily living, ADLs, such as dressing, grooming, feeding, and toileting. 1. For students with ID, OT aims to develop the skills needed to perform these tasks independently or with minimal assistance. 2. Motor skills development. OT interventions target the improvement of fine motor skills, e.g., handwriting, using utensils, and gross motor skills, e.g., balance, coordination, to enhance students' ability to participate in school and daily activities. 3. Sensory processing. OT addresses sensory processing difficulties commonly observed in students with ID. 3. By providing sensory experiences and strategies, OT helps students regulate their responses to sensory input and improve their ability to participate in daily activities. 4. Environmental modifications. OT practitioners assess the student's environment and recommend modifications or adaptations to promote accessibility, safety, and independence. 4. This may include adjustments to seating arrangements, workstation setups, and assistive devices. 5. Social participation. OT supports students' social participation by teaching social skills, promoting peer interaction, and facilitating engagement in leisure and recreational activities. Sensory integration techniques. 1. Sensory diet. A personalized sensory diet involves providing students with a variety of sensory experiences throughout the day to regulate their arousal levels and support attention and engagement in activities. 2. Sensory integration therapy. This therapy involves structured sensory activities designed to promote adaptive responses to sensory input, improve sensory processing abilities, and enhance motor coordination and self-regulation. 3. Environmental modifications. Sensory integration techniques include modifying the sensory environment to reduce sensory overload and create a sensory-friendly space that supports students' comfort and engagement. 4. Sensory tools and equipment. OT may recommend the use of sensory tools and equipment such as weighted blankets, fidget toys, sensory swings, and tactile materials to provide sensory input and promote self-regulation. Individualized approach. 1. Occupational therapists tailor interventions to meet the unique needs and abilities of each student with ID. 1. They collaborate with educators, parents, and other professionals to develop personalized treatment plans that address specific goals and challenges. 2. Sensory integration techniques are implemented in a client-centered manner, considering the student's sensory preferences, sensitivities, and individual differences. By incorporating occupational therapy and sensory integration techniques into educational programs, students with ID can improve their functional abilities, enhance their sensory processing skills, and participate more fully in school and daily life activities.